Well, I think the hospital is very, very important to Kano State because not just to Kano State, I think to Nigeria and other surrounding neighboring countries, because people come from far, Niger and other places from other states. It's cheaper. Like the obstetric surgeries are free, so everybody just troops in, and each day has its own duty. Let's say in the clinic, we see hundreds, like 100 and something, at least 90 something. And the team where I belong to, we see most of the patients. Our own workload is, more than every other team. So we see a lot of patients, especially in the clinic.
As a medical professional working in the accident and emergency unit, you tend to see a lot of critical cases. And the satisfaction mostly comes when you see that your patients have good outcomes. For instance, you take in a patient to resuscitate and the patient comes back fine and comes out of crisis and is fit, back on their feet and all, you tend to get maximum satisfaction from that.
The Murtala Mohammed Specialist Hospital in Kano State, Nigeria, is one of the oldest general hospitals in West Africa and one of the most important in the region. Established in the 1920s, the hospital has grown to become the largest maternity hospital in the country, recording over 10,000 live births a year. The hospital receives patients from across northern Nigeria and also neighboring countries, including Chad and Niger. Recognizing the central role Murtala Mohammed Specialist Hospital plays in the delivery of healthcare services in Kano State and northern Nigeria, the Dangote Foundation is intervening to improve the overall level of care and service delivery at the hospital through a combination of new build and renovated facilities and infrastructure. The current plan of the foundation, following a 200 million naira renovation of some of the hospital facilities in February 2017, is the construction of 3 new buildings that will house the accident and emergency unit, the surgical and diagnostic center, and the completely repurposed maternity unit at the hospital. Back in October 2013, the Dangote Foundation announced plans for the construction of an ultra-modern surgical and diagnostic center, the Hajia Maria Sanusi Surgical and Diagnostic Center. The 3 new buildings are updates and the revision of these plans following careful consultations between the foundation and the hospital staff in identifying their needs and creating facilities that meet 21st century healthcare standards. The foundation also had close consultations and partnership with the state government in the development and execution of the project.
When the foundation engaged Aegis to work on the project, they had already a design which is this building that is going on, but as a 5-story building. So they wanted to engage us to make sure that the medical reason of what is going inside the building fits with the actual needs of the hospital. So we decided to use the structure that we are already building to use it as a new maternity. We decided that for 2 main reasons. One is that this building is a bit isolated from the rest of the hospital, and it is good for a maternity because the maternity in itself is like a small hospital. It has its own all functions inside. It doesn't so much rely on other services from the hospital.
We are at the suspended building. The suspended building, which is now proposed to be the new SDC, that's the Surgical and Diagnostic Center. We have the theaters, we have the imaging department, and then the laboratories, and also some amenity wards on the first floor. And this building is actually of great importance in the whole project because it is going to house the theaters. And in the whole hospital, this is the heart of the hospital. It's centrally located. All the other departments in the hospital key in here.
And during our survey in December, we also realized that there was a gap for the accident and emergency ward, mainly due to its location that is across the road. and which entails to have to move patients across the road when they are not in a good condition. So we propose to relocate it on this side of the hospital, not too far from the future surgical and diagnostic center, so that in case they need to operate anybody who is in the A&E, they can transfer them quickly to the new SDC.
Today we are all living witnesses. The design team, they are around. We have gone around, we have gone to the main site, we have gone to the A&E site, and many people have seen. So the best solution that Dangote has taken to build another A&E within the hospital premises is the best solution for us, the best solution for Kano State government, the best solution for Kano people. And everybody I know will be very happy with this development.